Now, my name is Joe Doherty. I'm with the Utah Department of Public Safety, and it's my pleasure to welcome Governor Spencer Cox, and he'll be followed by Dr. Angela Dunn, our state epidemiologist, with all of our updates today. Governor Cox.
Thank you, Joe. Ladies and gentlemen, it's great to be back with you again at the end of another month. I would like to excuse and recognize Lieutenant Governor Henderson, who is down in southern Utah on the Navajo Nation, working there. We miss her here, but grateful for the wonderful work that she's doing in that part of the state. We want to share a few highlights this week, and then one important announcement that we have that we hope will help with vaccination. So let me just begin. If you missed it, the Johnson & Johnson vaccine is back. That's something that we're very excited about for many reasons that we've talked about in this forum before. But a single dose really does give us the best chance of vaccinating people who are harder to reach, whether it be by geography or personal schedules, or maybe less likely for whatever reason to return for a second shot. And even for those that don't like needles, we know that there is an extremely rare condition that can develop. None here in the state of Utah, and this vaccine is extremely safe and so much safer than the coronavirus that we hope that people will not have any hesitancy to get this or any other vaccine, and that we will be able to take this to those places that are harder to reach. Now, just a few updates. I know we give these every week, and you can find them on the website every day. But we now have administered over 2.1 million doses of vaccine. This is a daily increase of about 26,895 doses since yesterday. So again, still lots of people getting their vaccine. That is a combination of first and second doses. A week ago, our total doses administered was just north of 1.9 million, and this is a weekly increase of about 140,000 doses. Around 54% of eligible people in Utah have now gotten at least one dose of the vaccine, and we do see that number increasing every day. We've talked several times about vaccine equity in our presentations. Let me just give you a couple updates over the past month, some changes that we've seen. We just picked a couple of these to share. Asian adults went from 24.6% with at least one dose to over 39% with at least one dose over the past month. This is the month of April. Our Hispanic population went from 17.5% with at least one dose to over 31% with at least one dose. Our Black adults went from 13.1% with at least one dose to over 21% with at least one dose. And our Native Hawaiian and Pacific Islander community went from 15.2% with at least one dose to over 21% with at least one dose. So we're excited to see those changes there. Our white adults are at 48.7% that have received at least one dose of the vaccine. We now have more than 900,000 Utahns fully immunized against COVID-19. And I'm very pleased to announce that as of today, I am officially one of those that has entered the fully vaccinated category. And we couldn't be more excited. Just a reminder to those of you that are fully vaccinated, it's okay to act like it. It's a good thing. So spend some time with your friends and family and loved ones. Do some things that maybe you haven't been able to do over the past year. And please enjoy that vaccinated status. Just again, a couple more numbers of the Utahns who are age 70 and older. 88% of them have received at least one dose of the vaccine, and a remarkable 78% of them are fully vaccinated. 65 and older, that number is 86% who've received at least one dose, and 75% of this age group is fully vaccinated, which, by the way, is significantly above the national average in those age categories, and of course the most important age categories when it comes to hospitalizations and death and mortality rates. We do recognize that it is a choice to be vaccinated, and we hope that you will all choose to get the vaccines. Now, I want to talk a little bit about vaccine trends. We have, for various reasons, we have now passed, and we knew this would happen, that we would pass that point where supply starts to outweigh demand, and we are certainly there in the state of Utah. So there is no excuse for people to not be able to get a vaccine. They are widely available, and there are so many appointments available right now. And I just can't underscore this enough. While we are making progress, and Dr. Dunn will update you on the numbers, we've been in a plateau for several weeks. We're still declining, but declining very, very slowly. The race against the virus is still real. And she's going to talk more about this, but the importance of tamping this virus down now, while we have the upper hand, is so critical for lots of reasons, to avoid the variants that we're seeing across the country, make sure that we don't have to go through this again in a year for any reason. And the only way to do that is for people to get vaccinated. We desperately need you to get vaccinated. If you don't want to do this again, please, please, please get vaccinated. Because of that change, though, and this is the important announcement that I wanted to make, we've been preparing for this day from the very beginning. We knew that at some point we would actually have enough. What a great problem to have, where we haven't had enough vaccine. Now that we do, and now we want to take this fight. We want to take it to the people. We want to make it as easy as possible. We want to take away any excuses for not being able to get the vaccine. Our local health department partners will continue to operate the mass vaccination sites where most of us have gotten their vaccines. So those will continue to operate. That's very important, so people can go and get their vaccinations there. But we are shifting our approach now to bring the vaccine directly to you. Beginning today, organizations, whether any type of organization, whether they're businesses, employers, community-based organizations, church groups, any organization that is interested can go to coronavirus.utah.gov and can request to host their own free mobile vaccination clinic at their location. Okay? Let me be clear, we will come to you and at no cost to your organization. Right now, we have plenty of doses available to support this initiative. In fact, we're going to set aside about 25,000 prime doses from next week's allocation, about 1/3 of our total prime doses for next week, specifically for this effort. We have the doses available, and we're excited to be able to do this. This will really help us streamline our equity efforts, but we want to honor and recognize all of the incredible community-based organizations that have been involved so far. We've been doing some of this already, and I want to thank these coalitions: the Utah Pacific Islander Health Coalition, OCA, the Utah Asian Pacific Islander American Advocates, Comunidades Unidas, the Mexican Consulate, the Utah Muslim Civic League, the Urban Indian Center of Salt Lake, and many other faith and community organizations that have helped us pilot this program so far. And now we really want to put it on steroids. We want to go out and help as many people as we can. Now, of course, we hope to have an overwhelming response, which means if we do, and we don't have enough people or enough doses, be patient. If we can't get to you this week, we'll schedule you for next week or the week after that. We'll prioritize as we can, again, based on geography, based on equity, based on the number of people that your organization has. But please, please, please don't hesitate. We know that this is a powerful way for us to help get people. Some people, it's on their mind. They're busy. We know people have schedules. It's tough with your work schedules. And so if you're an organization that can benefit from having a mobile clinic on site, you can combine it with other health clinics. Many employers do health clinics throughout the year. I know when I was running our company, we would have a health clinic every year, and a place for people could check their cholesterol or other things. We can combine it with something you're doing. We'll encourage you to bring treats for everyone, whatever it takes, but we want to make sure that we have these mobile clinics available for you. So again, coronavirus.utah.gov, there will be a link there where you can click on that link, you can fill out your information, submit it to the health department. Be patient. Every time we do something like this, we get overwhelmed, which is a good problem to have. As I've said, our motto has been to embrace the chaos, but we have, again, lots of vaccines, lots of mobile clinics ready to go, and we can get started right away. So just be patient. If we don't get back to you right away, we will find a time and a place that will work and get that scheduled. So we hope that this will really jumpstart a new wave of demand among an entirely new population. And in the meantime, of course, don't wait. There are still plenty of options to get your vaccine, and we would encourage you to head out to one of those vaccination sites or to local pharmacies that have them available right now. Okay, just a quick update on the transmission index. Some more really good news this week showing that we are still improving. We have several counties, Beaver, Duchesne, and Morgan counties, 3 counties moving from moderate to low transmission. I'm pleased to announce with 16 counties now in low transmission, that is the largest number of counties that we've had in low transmission since we started the transmission index last year. And the first time we have more low counties in low transmission than in moderate since we really started seeing the recovery in February, which is, again, just great news. We still have 12 counties in moderate and 1 in high. I do need to note that there are still this, and again, Dr. Dunn will talk about this, but the virus is still out there and it's still moving around. There are still people being hospitalized and ending up in the ICU. We're still seeing, 20 to 30 people every day that are being hospitalized. Currently, 12.1% of our ICU beds have a COVID positive case. A week ago, the 7-day average was 11.5%. So we've seen a small uptick when it comes to our ICU hospitalizations. Of course, this is nothing like in December, back when we had 41.8% of our ICU beds were people with COVID, which was, again, we came within a hair's breadth of overwhelming our healthcare system. So we're so excited not to be anywhere near that. But it is still serious, and especially serious for those who have it. So protect yourself and get vaccinated. Now, with that, I'm excited to turn the microphone over to Dr. Dunn, and then we'll take your questions. Dr. Dunn.
All right, thank you, Governor, and good morning. So our 7-day average for new cases is now at 380. Last week we were at 386, and our percent positivity has increased just a little bit. This week we are at 6.5% for test over test. Last week we were at 6%, and for person over person we're at 3.5% now. Last week we were at 3%. We are definitely in a plateau statewide. However, we are seeing local outbreaks in schools and in tourist areas of the state. But really what's preventing a large surge from happening statewide is vaccination. These outbreaks are being driven by variants and by populations that can't get vaccinated. For example, we have a current outbreak going on in Elk Ridge Middle School in Jordan School District in Salt Lake County. They've identified over 40 new cases in the past 2 weeks. And these are kids who are not eligible to get vaccinated. They're too young. Salt Lake County Health Department will be hosting another testing event this Friday to help identify new cases and control the outbreak. And this outbreak has really been a huge burden and inconvenience for the school, for the students, and for the parents. So it's a reminder that we're still in the middle of a pandemic, and it's more important now than ever to get vaccinated if you are eligible. The more people that are vaccinated, the less COVID spread we'll have. And if there's less virus spreading around, there's less opportunity for that virus to mutate and for the variants to take hold here in Utah. So if you're eligible to get vaccinated and you haven't done that yet, I urge you to make your appointment today. We especially need our teens that are 16 and older and our young adults to get vaccinated. By you getting vaccinated, this is going to help our schools and businesses stay open safely. And if you've been reinfected, you don't have to wait 90 days anymore to get your vaccine. If you feel good and it's been 10 days, you finished your isolation period, go get vaccinated. This is really it. I mean, if we want to prevent another surge from happening in the fall, we all need to get vaccinated when we're eligible, so make your appointment today. Thank you.
Okay, we're happy to take questions.
Hi, Governor. It's Ben Winslow with Fox 13. On that note, with schools experiencing potentially some surges, are you planning on increasing restrictions? You have the Test to Stay program. Is that working at this point?
Yeah, so no plans to change anything there. It's why we've kept those procedures in place and masks, and again that will run till the end of the year with the test to play and the mask for for the very reasons that Dr. Dunn just mentioned. And so we just want to encourage people to be safe. What is great, Ben, and what I can tell you is I was able to look at the test to play numbers over a few days ago, and we saw the number of positive tests that came back in January, then February, then March and April, and every month we've seen a significant decline in the number of cases, which is just really good news. The percent positivity in those where we're testing and we're testing more than ever as we have dances and major gatherings happening. So it's really worked and it's been effective. And what's great about it is we have had major events in most school districts and most schools without having major outbreaks. So there are some outbreaks that are happening for sure, but this is just a sign that it's absolutely working, and we're excited about that. And I just want to point out and to Dr. Dunn's what she just said, if not for the incredible rate of vaccination that we've had in our state, I fully believe that, and I think most people believe that we would be seeing a third surge, a major surge, and we've been able to avoid that because of vaccination. So please don't stop now. If you haven't gotten your vaccines, we need you to get them.
Good morning, Governor. This is Jacob Klopfenstein with KSL.com. Dr. Dunn just mentioned that there's a need to get teenagers 16 to 18 vaccinated, and then young adults as well. I guess, is there any indication why those age groups are maybe lagging a bit? And are there any plans to specifically target that group to get vaccinated, either with mobile clinics or outreach or anything like that?
Yeah, so if you look at the numbers nationwide, I mean, Utah fits pretty clearly the numbers. With each decade of age difference, going from oldest to youngest, there is the demand diminishes a little bit, which makes sense because, of course, this virus is worse for people the older they are, and so I think that's just very natural. But as she said, and that's what I think was so important, and I just want to kind of highlight and underline what she said. The vaccine protects you, which is hopefully reason enough to get it. But there's a collective protection that happens from getting the vaccine as well. And by the more people that get it, even younger people, even if they may on average not get as sick as others and may not die at the same rate as others, the longer that virus is allowed to be here and to spread and to grow, the more likely it is that we could get variants that don't respond to the vaccine. And so there's more reasons than just protecting yourself to get it. Now you ask the question, what are we doing to help reach those different populations? Many schools are hosting vaccine clinics and encouraging parents and students who qualify for the vaccine to come and get those vaccines. In fact, my own kids' school, their high school held a vaccine clinic. My son was able to get vaccinated there, and many other kids. So that's what we're doing to reach out and to help those ages 16, 17, and 18 to get the vaccine. Doing the same things on colleges. Unfortunately, again, this is one area where the pause on the Johnson & Johnson vaccine really impacted things, and why we were so disappointed, because most colleges are finishing up this week or next week, and so we've been able to have some vaccination clinics there, but the Johnson & Johnson is the best one because they're leaving to go home, and the odds of them getting a second dose probably goes down, just knowing my own kids. And so getting that one dose is an even better way to do it. So we'll continue to work with and help our college-age students to get those. And I suspect in the fall when they come back that we'll have a major vaccination effort on our college campuses.
Good morning. This is Sebastian from Univision. Governor Cox, according to your opinion, why the Hispanic community has a lower percentage of fully vaccinated people in the state? Is it lack of access to doses or is it mistrust, maybe? Gobernador, según su opinión, ¿por qué la comunidad hispana tiene un porcentaje menor de personas totalmente vacunadas en el estado? ¿Es falta de acceso a las dosis o tal vez desconfianza?
Thank you, Sebastian. So I'll try to answer both in English and in Spanish. And again, please forgive my broken Spanish as we try to communicate. I think there are lots of different reasons, and I think what you said are definitely two of them. So access is really important. What I will say is when we started this, of course, we started with healthcare workers and frontline workers and teachers, and so there are just, if you just look at the numbers, there are less Hispanics in those fields than in others, and so that's certainly one reason. Access is another one, and that's why we're working so hard to get these into the communities, to change the timing. You know, lots of people can't just go during the day to get a vaccine if there's an appointment available. They could only do it on weekends or on others. And then there is some hesitancy out there. You know, can we trust these? So we're working with local community partners to make sure that they're able to do that. I will also point out that the Hispanic population in Utah tends to be younger than the rest of the population. We have a very vibrant and young Hispanic population, and so those same things that I just mentioned with the younger population are likely reasons that we're seeing a little bit lower uptake. But that is increasing at a faster rate than some other populations, and so that's the good news. Bueno, pues creo que hay muchas razones que la comunidad latina no han tenido lo mismo éxito en recibiendo esta vacuna, y lo hemos visto por donde trabajan, por su confianza en la vacuna y también por la juventud de la comunidad. Pero estamos haciendo todo lo posible para hacer que lo sea más fácil a recibirlo. Vamos a ir a las comunidades en los fines de semana y trabajando con las iglesias y otras organizaciones para que todos tengan las oportunidades y pueden tener podemos seguir fallando y ayudándoles para que podamos no tener esta enfermedad, or something like that. Thank you. Next question.
Good morning, Governor. It's Sean Means from the Salt Lake Tribune. You talked about the balance between supply and demand of the vaccine. We wanted to find out, is there a point where the allocations that go to the county and regional health districts will start to change based on uptake? For example, if one county is not using up their vaccines, will the overage be sent over to another county, or will there be more outreach sent to those districts that are not having as much uptake, whether it's worksite clinics or more doses to doctors or other ways to just get outreach out to the places that aren't using up their allocations?
Yeah, Sean, a really important question. I appreciate you bringing up, and the answer is yes to all of those things. And not only will we do that in the future, we have been doing that already. We have a high throughput coalition that meets every week, and it's all of these major providers that have come together, and they have been reallocating doses from the very beginning based on need and uptake. There was a time when when southern Utah was really slammed and needed more doses, and so we were allocating extra doses down there, and then that has flipped. So, for example, over the past 2 weeks, Salt Lake County has had the highest demand, and we were having unused doses in other areas, and so we did reallocate doses from those other areas into Salt Lake County, and that will continue. And then now what we're doing is exactly what you said at the end of your question, is we're starting to reallocate those doses into other areas. So, for example, one of the areas where we have not had many vaccines going, and those are local healthcare providers. We've been putting them in local pharmacies, but now getting them out to doctors, so as patients come in, they can just get a shot there. That's going to be the next wave of our vaccine effort. Now, you can imagine that those numbers are going to be much smaller. You know, a doctor in his office is not going to deliver 500 doses of vaccine in a day. He might do 2 or 3. And so those are the changes that we'll be making, and I will announce this too. When I came into office, in my executive order, one of the first things I did was to require that every provider use the doses allocated to them within 7 days. That was an important change because that was not happening, and that's what allowed us to get into the top 10 in doses delivered. We're going to be taking that part out now because we know that it's going to be impossible for some of our providers to use them within 7 days, and we don't want them to say, well, I'm not going to take any because I can't use it. We want it there so that when it's needed, it will be available. We also believe that as kind of that last wave comes in, that's going to happen with trusted doctors, that people who may not be getting it now will go to their doctor for something else or for this, and that they'll be able to have a direct one-on-one communication with somebody that they trust, and then they'll want to get the vaccine. I will also caution, though, and I want to share this. It's not happening right now, but I foresee a time when it will happen. The way that they package the vaccines right now, they package them, and they're actually increasing this a little bit, the number of doses in a vial, and also the storage requirements for these. When we get to that level, there will probably be some spoilage where we have to throw some vaccine away at some point because a doctor can't use all of it, but we have to get them some, and they don't come in single-dose vials. So we've been talking with the administration about getting us single-dose vials so we don't have to waste any of that vaccine, but we don't know how long that's going to take. Again, we haven't had any waste or any spoilage so far, but we're just thinking ahead to what that might look like, and we don't want that to happen, but we would rather have it available for people to get it where they're going to be.
Is that change in the executive order? Is that already taken effect, or is that taking effect?
I don't think it's taken effect yet, but it will be in the next couple days.
Okay,
So,
thank you.
Yeah, thank you. Last question?
Hi, Governor. This is Lisa Roche. I'm wondering if you could talk about the decision to reach out to organizations to schedule mobile clinics versus starting to send vaccines directly to doctors' offices, for example, or creating walk-up mass vaccination clinics. I know there are some now in some places, but I'm wondering about why mobile clinics at organizations versus other options for getting that vaccine out further into the community.
Yeah, thank you, Lisa. And what I do want to say is we will be seeing all of those things. So you will be seeing more and more of these vaccination sites, these mass vaccination sites, transitioning from appointment only to walk-up. That's going to be important and make it easier. You will start to see doses over the next few weeks going out to doctors. But the reason for focusing on these types of organizations, there are several, but the biggest one is it's a way for us to reach more people and get more uptake more quickly. And we've seen that again, people that have run their HR for their organizations that routinely do these health clinics. I know in my own organization, when I was running a telecommunications company, we were encouraging healthy behavior and trying to incentivize healthy behavior. And we would even give incentives for people to go and get a wellness checkup and do these types of things. And some people would, but most people wouldn't. But the day we had our health fair or health clinic, and we had everybody there, and we had food, and it was kind of this event. Like, everyone came and got their cholesterol checked, and everyone got their blood pressure checked, and it's just a way to reach more people more quickly. And this is a speed game. Again, if we want to avoid the variants, if we want to avoid any additional surges, we've got to get to as many people as possible, as quickly as possible. And all of our studies show that this is the next best way to do that. But this will be an all of the above approach. Again, as we continue to get more and more vaccine, we're going to put vaccines anywhere and everywhere that you can possibly get them. So with that, again, thanks to everybody. By the way, if you've not been outside yet today, it is a perfect day. We don't have enough of these days, so please go outside, take your mask off, go outside, enjoy this incredible weather, and we look forward to seeing you again next week. Thanks, everyone.
We appreciate Governor Cox being here. We wanted to see if anyone had any questions left for Dr. Dunn. She's still available for a few minutes.
Thank you so much. And Dr. Dunn, Chris Reed, St. George News. Quick question with kind of a follow-up on, there's two counties down here in southern Utah, Iron County and Kane County, that have basically said that there's a loophole in the mandatory school masks that rather than a doctor, if a parent sends a note, their kid does not have to wear a mask to school. I've looked at the language. It seems to be there. There seems to be a loophole, but if you can explain, is that a loophole? And if not, is anything going to be done about it? And as a follow-up, you've mentioned the school surges. We know the variants can infect kids more. Can the variants get kids sick more?
Sure. So to your first question, my understanding is that there isn't a loophole, and from the state perspective, we're still expecting K through 12 students to be wearing masks in school to prevent the spread of COVID and keep kids safe. But we also understand that there is a lot of controversy around that, and we're leaving enforcement and decisions about how to interact with communities and individuals who don't want to wear masks. That's going to be left at the local level. They really know their community best and can figure out the best way to address those issues. With regards to variants and spread among children, so what we know so far is that, of course, the variants are more transmissible. That means it's easier to pass from person to person. One person who's infected with a variant will infect many more people than the original strain of COVID-19. What's still left to be determined is if the severity of disease is increased among children. We know from our partners in Michigan that they are seeing more younger individuals hospitalized due to COVID. They are seeing an increase in children being hospitalized due to COVID with the surge they are experiencing. And their surge is due to the UK variant, or B.1.1.7. So hopefully what we can, take, I guess, comfort in moving forward is that the vaccines still work against these variants. And if we can get everyone who's eligible, 16 and above right now, to get vaccinated, that will in turn prevent spread to the younger population.
Just as a quick follow-up, and I know you're not on the enforcement side, and certainly, but at the same time, you mentioned it needs to be local control. It's basically local folks who are saying we're going to go ahead and we don't think masks are necessary anyway, so we're going to go ahead and skirt the rule here. If it's left to locals, do we run the risk of having more of these school surges that you mentioned earlier?
Yeah, absolutely. I think, the more we see individuals stop taking the precautions if they are susceptible to the virus, the more spread of the virus we're going to see. So that's definitely a concern we are seeing at the state level and with our public health departments. But of course, there's always this balance between making sure people feel comfortable entering into the school and still getting their kids educated with the spread of the virus. So that's a tricky balance that we've been, trying to figure out throughout this pandemic.
This has been Winslow with Don. With the change in approach with the vaccinations of the mobile clinics, doing more community outreach. Is there any projections about how much this might improve numbers as far as vaccinations to reaching herd immunity and ultimately terminating health orders, regardless of the legislature's bill?
Yeah, I mean, this is definitely the next step we need to take in our efforts to vaccinate everybody who wants a vaccine. Of course, the mass vaccination sites, we saw a huge uptake really, really quickly because that's kind of your low-hanging fruit. Everybody who is very comfortable to get vaccinated and they're okay going to a mass vaccination site. And now we're ready to transition to making it easier for people who, might not want to get vaccinated as readily as kind of the initial surge of people wanting to get vaccinated. So we're still in a good spot and moving towards community-based vaccinations, making it easy for people by putting it at their work site or putting it in a place where they visit regularly is going to allow more people to get vaccinated. But the uptake will likely be slower. As Governor Cox said, you just won't get the same numbers of thousands a day getting vaccinated at a single site with these efforts.
Dr. Dunn, if I could follow up on that, the governor said that it's going to be an all of the above approach. Getting the vaccines out to people's doctors, for example. I know you've spoken about how that's a good way of reaching some people who are hesitant or not as quick to get vaccinated. What kind of timeline are we looking at for getting those vaccines out to doctors, for people who are waiting for that, or for mass vaccination sites that are just walk-ups? So once people muster their enthusiasm or courage, they can just go get it, not have to.
Yeah. So, I mean, in terms of the mass vac sites being walk-up, that definitely depends on the site. So they first have to make sure they have the capability of serving everybody that gets an appointment, and then have the capacity to additionally serve people who have walk-ups. And the one county that's had tons of demand for appointments has been Salt Lake County, but they now are just moving towards the walk-up method as well. So we're there with the walk-ups. In terms of getting vaccines into physician clinics and to doctor clinics, that's already happening at some level as well. Again, it's that balance between making sure that the providers who can do thousands of doses a day are still being maximized before switching to low volume providers. Because at this point, we just need numbers of people to get vaccinated. So whatever is the most efficient, effective way to do that, that's where we're at. But again, in some jurisdictions, they've already seen a huge decrease in demand at their mass vaccination sites and have already shifted to the provider model in addition to these mobile community clinics. So it's going to look different at every part of the state, but we, again, meet weekly to determine what that's going to look like for the following week and go with the trends that we're seeing in demand.
Do we have a breakdown of what jurisdictions are sending it to doctors at this point?
If you look on our website, we do break down the vaccines by provider type. And so you can see whether, it's a local health jurisdiction, which would be your mass vaccination site, versus provider, et cetera.
Do we know which parts of the state are more likely or are pushing that sooner rather than later?
Sure. So we've seen kind of our more rural jurisdictions and the ones that are less populated move away from the mass vax or decrease the mass vaccination push more quickly than our more urban sites, and that makes sense, right? So the more people you have in a smaller geographic distribution, the more likely the mass vac sites are going to work. So in our more rural states, they've started to move towards the providers and smaller distribution channels more quickly than the Wasatch Front. Okay, thank you, guys.
All right, that concludes our briefing. Thank you, everyone, for your participation. We're always grateful for our interpreters. Our next briefing is scheduled for Thursday, May 6th, same time, same place. So thank you very much and be safe.